I'm Abigail Hansen.
I'm Joshua Mace.
I'm Frederick Metters.
And I'm Madison Michaud.
And our project is modifying a cervical pessary for the controlled release of progesterone for the prevention of preterm birth.
About 1 million parents lost their children to premature birth in 2015 alone. Now worldwide, about 15 million babies are born prematurely every year, and of all the countries in the world, the US is ranked 6th. Now on top of the developmental issues that occur from premature birth, there's also a really heavy financial burden on the families of infants with premature birth. And it was about a $30 billion industry in 2015 alone. Now there are a few risks that can be identified in mothers that will cause premature birth, which includes the length of their cervix or their medical history. But even with these identifiers, since the 1980s, the number of preterm births hasn't gone down, and actually in the past 2 years it's gone up. So there's a huge area for this to be improved.
So echoing the previous slide, current preventative methods for the prevention of preterm birth are limited and need to be improved. Now these two most common mechanical intervention methods are the cervical circlage or the cervical pessary. The cervical circlage is the most invasive method and involves suturing the cervix shut. It requires anesthesia and cannot be used for women pregnant with twins or past week 24 of gestation, as it risks rupturing the amniotic sac and actually unintentionally causing preterm birth. The other method, as discussed previously, is the pessary. And the cervical pessary is a very easy technique to insert and is non-invasive, but it's been shown to be limited on its own and therefore requires weekly progesterone injections as well, which cost up to $1,000 a week and aren't always covered by insurance. Therefore, there remains a need for a product that is cost-effective and combines the progesterone delivery with the pessary insertion.
So the way that this project proposes to combine these two treatments is by surface coating a normal silicone pessary with several layers of progesterone conjugated PLGA. PLGA has roughly a 3-week degradation time within the body, so each one of these layers would be coated with a 3-week dosage of progesterone, which is roughly 750 milligrams. Progesterone itself is a good drug to use to prevent preterm birth because it increases the expression of some proteins that inhibit contraction and decreases the expression of other proteins that are associated with contraction. So therefore it's biofunctional in the sense that it stops contraction from happening, which can lead to labor. Additionally, the environment in which this would be placed for PLGA will not affect its degradation time, which it can be affected at a low pH, but the pH of the vaginal canal is roughly 3.8 to 4.5, so it won't be affected. And finally, the thickness of the polymer layers will not affect the ease of insertion of the pessary because polymer layers have been used in other biomedical devices that have small space constraints where they're inserted, and it has not been a problem. So a quick rundown of the benefits and costs of our project. It can be filed as a 510K because it's a combination of a previously existing device and drug that have both been approved. Additionally, the polymers that we're using have also been approved by the FDA, so all of this together should vastly decrease the time that it takes for this device to get approved. It will also reduce medical costs for patients and improve their quality of life by eliminating the need for weekly progesterone injections, which can be very expensive and painful. The costs of our project are the surface coating technique will add some time and money to the manufacturing process for the pessaries, which will increase their individual unit cost, and we will have less control over the drug release profile of the progesterone because it cannot be altered once the pessary is inserted.
So the most common mechanical intervention used for preterm birth prevention is the Arabin pessary, which can be seen right here. It's an inert silicone pessary used to hold the cervix shut, and as stated before, in order to be effective, needs to have supplemental progesterone injections. The current gold standard for this is known as Makena, and it's an intramuscular injection administered by the patient's doctor weekly, and again is most often not covered by insurance, therefore providing a huge financial burden for the mother and their family. Additionally, there's a pessary approved in the UK called Cyclogest, and it's a wax-coated pessary administered daily by the patient. However, its approved indication is not for the prevention of preterm birth, as well as only being approved in the UK. Finally, there's a patent application filed for a progesterone-impregnated vaginal ring, which includes a single outer layer of impregnated progesterone with a biomaterial. However, we believe our multi-layer mechanism will offer a more controlled release drug profile, therefore filling the gap that is created by this current competition. Thank you.